Imagine living on a beautiful remote island. The sun shines, the ocean is blue, and life is simple. But what happens when you get sick? What if you need a surgery that is not available? For millions of people in isolated island communities, this is a daily reality. Access to basic healthcare, let alone advanced medical treatment, can be a distant dream. Local clinics, if they exist, are often understaffed and lack the necessary equipment. Traveling to a larger city for care is expensive, difficult, and sometimes impossible. This gap in healthcare leaves many vulnerable, turning treatable conditions into life-threatening emergencies. This is where a remarkable solution sails into view: the floating hospital. These are not just boats with a first aid kit. They are massive ships, fully equipped with modern medical facilities. Think of a state-of-the-art hospital, but one that can travel across the vast oceans. These vessels bring surgeons, doctors, nurses, and life-changing medical technology directly to the people who need it most. They anchor near remote islands and offer their services for free. For the communities they serve, the arrival of a hospital ship is a momentous occasion. It represents hope, healing, and a connection to a world of medical care they thought was beyond their reach. These floating hospitals are a beacon of hope on the waves. They are designed to provide a wide range of medical services. On board, you will find operating rooms, recovery wards, dental clinics, and eye care centers. They carry advanced diagnostic tools like X-ray machines and CT scanners. This allows medical teams to accurately diagnose problems and provide the right treatment. From complex surgeries to simple health checkups, these ships are equipped to handle it all. They bring a level of medical sophistication that can transform the health and well-being of an entire community, one patient at a time. The mission of these hospitals goes beyond just treating illness. It is about restoring dignity and providing a chance for a better life. A child who can see again after a simple cataract surgery can go to school and learn. A mother who receives a life-saving operation can continue to care for her family. A fisherman with a repaired hernia can return to work and support his village. The impact of a single medical procedure can ripple through a community, creating lasting change. Floating hospitals are more than just medical providers. They are deliverers of hope, sailing to the forgotten corners of our world to heal and serve. The need for floating hospitals highlights a major challenge in global health today. Many people live in places that are geographically isolated. Think of the thousands of islands scattered across the Pacific Ocean or the Caribbean Sea. These communities are often cut off from the healthcare infrastructure that many of us take for granted. Building and maintaining a modern hospital on every remote island is simply not feasible. It requires immense resources, a steady supply of electricity and clean water, and a large team of skilled medical professionals willing to live there permanently. This is a challenge that many governments and organizations struggle to meet. Floating hospitals offer an innovative and practical solution to this problem. Instead of building countless permanent structures, a single mobile hospital can serve numerous communities. A ship can spend several months docked near one island group, providing intensive medical care before moving on to the next location. This model is incredibly efficient. It consolidates expensive equipment and highly specialized medical talent in one place. This floating hub of expertise can then be deployed wherever the need is greatest. It is a smart and compassionate way to bridge the healthcare gap for the world's most isolated populations. The impact of these floating medical centers is profound. They don't just parachute in, perform surgeries, and leave. A key part of their mission is to work with and train local healthcare workers. By sharing knowledge and skills, the hospital ship's team helps to strengthen the local health system long after the ship has sailed away. They might train local nurses in new wound care techniques, or teach community health workers how to identify early signs of common diseases. This focus on education and partnership ensures that the positive effects of their visit endure, building a legacy of improved health and self-sufficiency. Ultimately, floating hospitals are a powerful symbol of global solidarity. They are often staffed by volunteers from all over the world. These dedicated individuals give their time and skills to help people they have never met. This spirit of generosity and collaboration is what powers these incredible vessels. They demonstrate that with creativity and compassion, we can overcome the immense challenges of delivering healthcare to the ends of the earth. In the following sections, we will explore the history of these amazing ships, the technology they carry, and the incredible stories of the lives they have changed. The idea of hospital ships began out of necessity during war, with ancient Greeks and Romans designating ships to treat wounded sailors. By the 17th century, navies like the British converted warships into floating hospitals. Early ships were basic and cramped, but saved countless lives at sea. The World Wars saw hospital ships expand massively, bringing advanced care closer to the front lines. These pioneers proved complex medical care could be delivered at sea, paving the way for today's humanitarian missions. After World War II, surplus military ships found new purpose. Visionaries saw these vessels as floating hospitals for those in need. Mercy ships led the way, converting the anastasis into a hospital ship. These ships brought free, life-changing care to the world's forgotten poor. Volunteers from around the globe joined together, transforming warships into symbols of hope. Today's hospital ships, like the Global Mercy, are marvels of engineering, purpose-built, massive, and packed with advanced medical technology. Inside, they rival land hospitals, with operating rooms, intensive care units, and diagnostic labs. These floating cities support hundreds of volunteers and generate their own power and water. Their legacy of healing and innovation continues long after they sail away. At the core of every hospital ship is its state-of-the-art operating room, sterile, isolated, and equipped with advanced air filtration. These aren't makeshift spaces. They rival top land-based hospitals, with bright surgical lights and the hum of monitors. Surgeons from around the world perform thousands of life-changing procedures, restoring sight, repairing cleft palates, correcting bone deformities, and removing tumors. Cutting-edge technology, anesthesia machines, electrosurgical units, and high-definition monitors ensures precision and safety. Every instrument is meticulously sterilized and organized, supporting the surgical team's expertise. The ship's stabilization systems keep the operating room steady, so surgeons can focus on their work, forgetting they're even at sea. Success here depends on both human skill and brilliant engineering. These floating operating rooms bring world-class surgery to places that need it most. It's a fusion of compassion, innovation, and adaptability. This is where hope is restored, one patient at a time. Accurate diagnosis is the foundation of effective treatment, and hospital ships are equipped with powerful diagnostic tools. Digital X-ray and CT scanners provide instant, detailed images, allowing doctors to identify injuries and illnesses with precision. For many patients, it's their first experience with such technology, transforming care in regions where only basic exams were possible. Onboard labs analyze blood, urine, and tissue samples, delivering results in hours, not weeks. These rapid diagnostics guide every step of care, from screening to recovery. Surgeons can plan complex procedures with confidence, reducing risks and improving outcomes. The ship's diagnostic capabilities are a leap forward for remote communities. Every patient benefits from the same high standard of care found in leading hospitals. Advanced diagnostics at sea mean faster answers and better healing. This is the backbone of the hospital ship's mission. A hospital ship is more than a medical facility. It's a self-sufficient city designed for independence. Massive generators supply uninterrupted power for life-saving equipment. Advanced purification systems turn seawater into thousands of liters of sterile water daily. The ship houses hundreds of volunteers from around the world, with living quarters, dining halls, and even schools for families. Logistics teams meticulously stock months' worth of medical supplies and provisions before each mission. Every detail, from meals to maintenance, is managed on board. This self-sufficiency ensures the ship never strains local resources. Volunteers focus on healing, supported by a strong onboard community. Behind every surgery and diagnosis is a seamless support system. This invisible backbone makes world-class care possible anywhere. Hospital ships harness digital technology to connect with specialists worldwide, even from remote anchorages. Telemedicine bridges allow real-time consultations, sharing scans and data for expert guidance. This expands the expertise available to every patient, no matter their location. The digital link is also a powerful tool for training local healthcare workers. Onboard labs and conference rooms host hands-on workshops and simulations. Webinars and online sessions reach professionals across entire regions. Ongoing mentorship continues long after the ship departs. This approach builds local capacity and leaves a lasting legacy. Floating hospitals heal today and empower communities for tomorrow. Technology-driven collaboration is transforming global healthcare. In a remote village in Madagascar, Mamadou lived in darkness, blinded by cataracts since childhood. His family, unable to afford surgery, had lost hope until a hospital ship arrived at a distant port. After a long journey, Mamadou was examined and scheduled for a simple sight-restoring operation. The day after surgery, he opened his eyes to see his mother's face and the blue sky for the first time. Joy and wonder replaced years of shadows. Mamadou's story is one of thousands, proof that floating hospitals deliver more than medicine. They bring hope, possibility, and new beginnings. Each patient's transformation ripples through families and communities. The impact of a single surgery can last a lifetime. This is the true power of healing at sea. On a small island in the Philippines, Maria suffered from a massive goiter, making it hard to breathe and causing her deep shame. Hope arrived when she heard about the Hope Ship, a floating hospital offering free surgery. With her husband, Maria traveled to the ship, where kind doctors performed the life-changing operation. Maria returned home healthy, embraced by her children, grateful for her second chance at life. Dr. Mark Schreim was a top surgeon in Boston but felt something was missing. Discovering mercy ships, he left his career behind to serve as a volunteer surgeon on a floating hospital in West Africa. There, he saw patients with life-threatening conditions he'd only read about, and realized the profound impact he could make. Dr. Schreim found his true calling, dedicating his life to healing those who need it most. When the global mercy prepares for a mission, hope begins to ripple through the community long before the ship arrives. In places like Sierra Leone, news of the ship's arrival unites everyone, leaders, volunteers, and families, around a single goal: healing. Massive screening events bring thousands together, traveling for days to seek care and support each other. The ship's visit transforms lives, strengthens communities, and leaves behind hope that lasts long after it sails away. While surgeons and nurses get the spotlight, the floating hospital's life-changing work depends on a diverse team of unseen heroes. Volunteers and crew work tirelessly behind the scenes, keeping the ship running safely and efficiently. Biomedical technicians, engineers, cooks, and therapists all play vital roles, ensuring surgeries succeed and patients recover. Each person is a vital link in the chain of hope, the quiet heroes who make miracles possible. Operating a floating hospital is a noble mission, but it comes with immense logistical challenges. Securing permissions, port access, and visas requires delicate negotiations with host nations. Maintaining a steady flow of medical supplies is like running a small city at sea. Screening thousands of patients and managing crowds demands careful planning and local partnerships. And through it all, the crew's ingenuity keeps the hospital ship running, no matter the obstacles. Floating hospitals face not just logistical, but also financial and cultural storms. Running these ships is costly, relying on donations and a vast network of volunteers who often pay their own way. Crews must also bridge cultural gaps, working with local translators and respecting traditions to build trust. By training local medical teams, they ensure care continues long after the ship departs. Floating hospitals are more than ships. They're ambassadors of hope, bringing advanced healthcare to remote communities. Their journey from military vessels to modern humanitarian platforms proves what's possible when compassion meets innovation. With new technology and global teamwork, these ships are charting a course toward a healthier, more connected future for all.